delve into the realm of ambulatory anesthesia from a pediatric perspective. We'll cover not just pediatric considerations, but also delve into the meticulous preparation of children for ambulatory surgery, including preoperative fasting, laboratory testing, psychological preparation, pharmacological premedication, pre-induction techniques, and even parents' presence during induction. Venture into the world of specialized pediatric equipment like airway and monitoring apparatuses. Familiarize yourself with anesthetic agents and techniques, including inhalational anesthetics, and adjunct agents. Grapple with the complexity of fluid management and unravel the secrets of postoperative analgesia, covering everything from mild analgesics and nonsteroidal anti-inflammatory drugs, NSAIDs, to anesthesia. Empower yourself with in-depth knowledge and expertise in pediatric ambulatory anesthesia. Embark on your journey today. Following from our introductory scene, let's delve deeper into pediatric considerations in ambulatory anesthesia. Children are not just small adults. They have unique physiological, psychological, and even pharmacological needs. We will explore the differences in anatomy and physiology between adults and children, and how these differences impact the choice of anesthesia. We will also look at the psychological aspects of anesthesia in children, the importance of a child-friendly environment, and the role of parents in the process. We will discuss the pharmacological considerations, including the differences in drug metabolism and the use of age-appropriate dosages. Finally, we will touch upon the importance of post-operative care in children, including pain management and the prevention of nausea and vomiting. So strap in as we navigate the intricacies of pediatric considerations in ambulatory anesthesia. In this next segment, we'll focus on the significant steps involved in preparing children for ambulatory surgery. The preparation stage is critical in ensuring the child's comfort, safety, and successful recovery. Firstly, we consider preoperative fasting, a necessary measure to prevent aspiration during anesthesia. However, prolonged fasting can be distressing for children, hence the need for clear and age-appropriate instructions. Next, we look at preoperative laboratory testing. These tests are crucial in identifying any underlying issues that may affect the choice or administration of anesthesia. Psychological preparation is another key aspect. Children can find the unfamiliar hospital environment and the idea of surgery quite daunting. Therefore, it's vital to use child-friendly language and even play-based techniques to explain the process to them. Pharmacological premedication plays a part too. It can help to reduce anxiety, minimize pain, and even help with a smoother induction of anesthesia. Speaking of induction, we'll discuss the variety of pre-induction techniques that can be used to ease the child into the anesthesia process. And lastly, we'll examine the role of parents during the induction phase. Their presence can often provide a sense of comfort and security for the child. Stay tuned as we explore each of these steps in detail, shedding light on the complexities of preparing our little patients for surgery. In this segment, we're going to delve into the critical equipment used in pediatric anesthesia. As we shift our focus from the preparatory phase, it's essential to understand the role of the right tools in ensuring a smooth and safe anesthesia process. Specialized pediatric equipment is a must, as one size does not fit all, especially when dealing with our little patients. Firstly, let's talk about the airway equipment. Pediatric airway anatomy is considerably different from adults, necessitating specially designed airway management tools. From laryngoscopes with varying blade sizes to different sizes of endotracheal tubes, each piece plays a vital role in maintaining a clear airway during surgery. Next, we have monitoring equipment. Continuous monitoring of vital signs is crucial in the perioperative period. Pediatric monitors cater to the unique physiological parameters of children, ensuring accurate readings of heart rate, blood pressure, oxygen saturation, and more. But it's not just about having the right equipment. Anesthesia providers must be proficient in using these tools, understanding their nuances, and knowing when and how to adapt based on each child's needs. After all, the goal is to ensure the child's safety and comfort throughout the process. In the following scenes, we'll dive deeper into each piece of equipment, demonstrating its use and discussing its importance in pediatric anesthesia. Stay tuned for an insightful journey into the world of pediatric anesthesia equipment. In this part, we will explore the different anesthetic agents and techniques used in pediatric anesthesia, focusing on inhalational anesthetics, intravenous anesthetics, and adjunct agents. Let's start with inhalational anesthetics. These are often the go-to for induction in children due to their non-invasive administration. Common examples include sevoflurane and nitrous oxide. They are easy to titrate, provide rapid onset, and allow for quick recovery. Moving on to intravenous anesthetics. These are usually used for maintenance of anesthesia and include agents like propofol and ketamine. They provide a deeper level of sedation and can be used in combination with inhalational agents for a balanced anesthesia approach. Lastly, adjunct agents. These are additional drugs used to enhance anesthesia, manage pain, and control side effects. Common examples are opioids for pain control, benzodiazepines for sedation, and antiemetics for nausea and vomiting. Understanding these agents and how to use them effectively is crucial for a successful anesthesia experience. Keep in mind that every child is unique, and the choice of agents and techniques should be tailored to each individual patient's needs. In the next scene, we'll look at the practical application of these agents and techniques, so stay tuned for more insights into the world of pediatric anesthesia. In this segment, we will discuss the importance of fluid management in pediatric anesthesia. Fluid management is a critical aspect of anesthesia care, particularly in pediatrics. It starts with understanding the child's fluid status before surgery and continues with careful monitoring and adjustment of fluid balance during and after the procedure. Children have unique fluid requirements and are more susceptible to both dehydration and fluid overload, making their management challenging. Before surgery, the child's hydration status should be assessed and any deficits corrected. During surgery, maintenance fluids are administered to replace normal losses and any additional losses from the surgical procedure. Common fluids used include crystalloids like normal saline or lactated ringers, and colloids like albumin. In addition, children may require replacement of blood loss with blood products. The choice of fluid and the rate of administration must be individualized based on the child's age, weight, underlying health conditions, and the nature of the surgery. Monitoring of fluid balance is also crucial. This includes regular checks of vital signs, urine output, and blood tests as necessary. Postoperatively, fluid management continues until the child is able to maintain adequate hydration orally. Remember, fluid management in pediatric anesthesia requires a delicate balance. Too little can lead to dehydration and shock, while too much can lead to fluid overload and heart failure. In the next scene, we'll cover the importance of postoperative care in pediatric anesthesia. So stay tuned as we delve deeper into this fascinating field. Following our discussion on fluid management, the next key area we're going to explore is postoperative analgesia in pediatric anesthesia. This aspect is key in ensuring the child's comfort and promoting a smooth recovery process after the procedure. Management of postoperative pain in children is a delicate balance, requiring careful consideration of analgesic options, their efficacy, and potential side effects. The goal is to minimize discomfort while avoiding oversedation and other complications. Mild analgesics, such as acetaminophen and ibuprofen, are often the first line of treatment for postoperative pain. These medications are generally safe for children and can effectively control minor to moderate pain. However, they should be used with caution in children with liver or kidney disease. Non-steroidal anti-inflammatory drugs, or NSAIDs, are also commonly used. They can be particularly effective for pain associated with inflammation, but again, they should be used judiciously, as they can cause stomach upset and other side effects. In cases of more severe pain, regional anesthesia can be an option. This involves numbing a specific area of the body and can provide significant pain relief without the systemic side effects of opioids. Techniques like epidural or caudal blocks can be used depending on the surgical site. It's important to remember that each child is unique, and so is their response to pain and medication. Thus, a tailored approach to postoperative analgesia is crucial. This involves regular pain assessments, timely medication administration, and adjustments as needed based on the child's feedback and observation. In our next scene, we will continue our exploration of pediatric anesthesia, focusing on the role of parents in the process. So, stay tuned.